Measles, rubeola revaccination, recommended for people inoculated in the 1970s and 1980s. Pause each illustration for detailed study of the illustrations and data contained in this review of the literature. Top images: a child showing a day 4 measles rash. Measles vaccination. Skin sloughing off of a child healing from measles infection. Bottom image: Koplik spots on the day of measles rash. Koplik spots are the peculiar spots present on the buccal mucosa and are considered a diagnostic pathognomic feature of measles rubeola in the pre-eruptive stage. In 1963, 2 measles vaccines, one live and another formalin inactivated, became available and were administered to the public. By 1968, an improved version of measles vaccine was formulated and was combined with the available mumps and rubella German measles vaccines, referred to as the measles, mumps, rubella MMR vaccine, and by 1971 was administered as an initial inoculation and a subsequent booster. In 2005, the varicella vaccine resulted in the measles, mumps, rubella, varicella, MMRV combination vaccine, administered via an initial and one booster dose. Since in the 1970s and 1980s, some vaccinees only received a single measles virus inoculation, revaccination with the current combination vaccine is recommended for this group of individuals. Some individuals were administered a combination of both vaccine types back in the day, and their immunity may have also waned to date. Unvaccinated and inadequately vaccinated individuals possessing insufficient acquired immunity to measles are at a 90% risk of infection upon exposure to the measles virus, obviating the necessity for revaccination as per currently accepted medical practice. Measles, also referred to as rubeola, and less commonly morbilli, is a highly contagious, usually benign paramyxovirus commonly affecting children, as well as non-immune individuals of every age. The portal of entry of this virus into the body is the respiratory tract via droplet nuclei, multiplying in endothelial cells and spreading throughout the reticuloendothelial system. Lymphoid hyperplasia with giant Warthin Finkeldy cells are produced. Skin eruption is generally preceded by coryza, cervical lymphadenitis, Koplik spots, palpebral conjunctivitis, photophobia, myalgia, malaise, cough, and steadily increasing fever. A rash of macropapular lesions initiating behind the ears, neck, and face, and subsequently appearing on the trunk and the extremities becomes manifest. Measles-related eye disease can result in conjunctivitis, keratitis, corneal scarring, retinopathy, optic neuritis, and blindness. Complications including secondary infections such as laryngitis, otitis media, giant cell pneumonia in immunocompromised children not involving rash, possibly leading to mortality, and rarely subacute sclerosing panencephalitis years after initial infection. Measles at a glance. Please pause for detailed study. This thin section transmission electron micrograph revealed the ultrastructural appearance of a single virus particle or virion of measles virus. The measles virus is a paramyxovirus of the genus morbillivirus. It is 100 to 200 nanometers in diameter with a core of single-stranded RNA. Two membrane envelope proteins are important in pathogenesis. They are the F fusion protein, which is responsible for fusion of virus and host cell membranes, viral penetration, and hemolysis, and the H hemagglutinin protein, which is responsible for adsorption of virus to cells. There is only one antigenic type of measles virus. Although studies have documented changes in the H-glycoprotein, these changes do not appear to be epidemiologically important. Measles virus is rapidly inactivated by heat, light, acidic pH, ether, and trypsin. It has a short survival time of less than 2 hours in the air or on objects and surfaces. Measles morbillivirus virion structure and measles morbillivirus genome structure illustrations. Measles morbillivirus. Adult maculopapular rash of measles. Measles is a serious disease illustration. Please pause for detailed study. Hazy, fluffy, ill-defined shadowing infiltrating both lung fields with a minimal left pleural effusion consistent with measles pneumonitis. Pneumonitis caused by infection is pneumonia. Some patients will develop pneumonia as a sequela to the measles. Histologically, a unique cell can be found in the paracortical region of hyperplastic lymph nodes in patients affected with this condition. This cell, known as the Warthin-Finkeldy cell, is a multinucleated giant with eosinophilic cytoplasmic and nuclear inclusions. Shown is an image depicting histological section of lung specimen in a patient with measles-associated pneumonia. Viral encephalitis leads to several neurologic sequelae. Primary encephalitis is caused by viruses that infect the brain as their principal target. Secondary encephalitis is caused by viruses that do not infect the brain as their principal target. Please pause for detailed study. Red eyes, conjunctivitis, in an adult patient with measles. New presentations coming soon. Like, share, subscribe, and ring the bell for notifications. Thanks for watching. Thank you to current and new subscribers.